How do you think the stories that Abortion in America have already told have moved policies across the US? Is there a direct line you can tie or anecdotes you've heard from lawmakers who's perhaps heard of someone who was having a miscarriage and had trouble accessing the healthcare she needed and then maybe reversed their position on the law in their state?
With all humility, Abortion in America launched publicly in October of this year. So we are really committed to understanding the research that can help us show the impact of the stories that we are sharing. That's going to be a big focus of ours in 2025. But in terms of the impact of these stories more generally, or the stories of people who we've worked with, I think one of the most powerful examples is Nancy Davis in Louisiana. She and her partner found out shortly after Roe versus Wade was overturned that their much wanted pregnancy had a fetal anomaly that was incompatible with life. So the baby would not survive. And the condition was called fetal acrania. And in that case, these babies are often developing without a skull or portions of their brain. And there's really just, it's very tragic. It's news no parent wants to hear. And Nancy should have been able to access abortion in Louisiana under the exceptions. But again, these laws are written by politicians with, in many cases, no medical expertise. And so they are vague and they are written in political terms, not medical terms. So as she and her partner struggled to navigate Louisiana's new abortion ban, they could not find a doctor who would provide this procedure for them because it was unclear whether or not they actually qualified for an exception. So ultimately, Nancy was able to get the support from an amazing organization called the Bridget Alliance, among others. She came here to New York City. She received an abortion at Planned Parenthood in New York. She was incredibly grateful, and so was her partner, for the care that she received and the way she was treated here. But she was so fired up after this experience, and she wanted to make sure that nobody else would have to go through what she went through. So she started speaking out. She started holding and organizing rallies at the Capitol in Baton Rouge. She just would not, she was not going to go quietly into the night here. She had a story to share and she wanted to share it. Because of this, there's still a lot of important work to do. Louisiana is still a state with one of the harshest abortion bans in the country. But thanks to Nancy, the specific condition that she was diagnosed with, that her fetus was diagnosed with, has been added to the list of exceptions. So that's a small example, but think how impactful that is for someone else who now gets that same diagnosis, who doesn't have to jump through all of the hurdles Nancy went through, who doesn't have to travel out of state, away from their community, away from their family to get care that should have been accessible to them where they live. So
Yes.
that's one example, but there are many.
I think that's a powerful example because we often talk about big problems needing big solutions, but sometimes the way you solve something in the private sector or the public sector is one little step at a time. And speaking of one little step at a time, we are literally in the middle of a presidential transition right now. 2025 seems like it carries a lot of unknowns. What are you looking for and strategizing for in 2025, which is not a big election year, so garnering attention could be a little more difficult than it was this year?
Abortion in America is a 501(c)(3), so not a political organization. So I want to acknowledge the work of folks who are doing advocacy work and really pushing still for big change and progress anywhere and everywhere we can possibly achieve it, and lobbying lawmakers and doing work that is also really essential. What we're focused on at Abortion in America, again, is continuing to make sure that the stories of people who are personally affected by abortion bans are front and center in conversations about reproductive health. We want to make sure that whether it's lawmakers or constituents or anyone living in this country, no one is saying, we actually think these abortion bans are working really well and advancing public health and safety, because we know that's not the case. We are really laser focused on making sure people know that abortion bans have an incredibly detrimental impact on maternal health, access to pregnancy care and prenatal care. My friend Caitlin Joshua, who is another of our co-founders at Abortion in America, has shared her story of being denied an abortion, being denied miscarriage treatment in Louisiana. But even before that happened, she picked up the phone to make a doctor's appointment when she learned she was pregnant with a much wanted pregnancy and was told she could not come in for prenatal care until after she was through her first trimester, when the risk of miscarriage was lower because healthcare providers were afraid of prosecution under Louisiana's law. That is a story everyone should know. And that's really our mandate. That's what we're focused on. So, as these conversations and important decisions are made at the national level about what policies to pursue, or at the state level around how to implement abortion bans or laws repealing abortion bans, we want to make sure that the voices of these people who have been directly impacted by these laws across the country are heard.